Welcome. I'm Barbara Brandt, Director of the National Center for Interprofessional Practice and Education. We're happy to host you today in this webinar through the relaunch of the National Center's Assessment and Evaluation homepage. We will be introducing you to the Measurement Instrument Collection and our new Practical Guide series. I want to introduce my fellow presenters today, Connie Schmidt, who is a retired associate professor at the University of Minnesota Medical School and is an educational psychologist specializing in measurement, learner assessment, program evaluation, and educational research. Connie does a lot of work with the National Center. And Eduardo Salas, he's currently a professor, the professor of Alan R. and Gladys M. Klein Chair of Psychology at Rice University, and he is the 2016 Distinguished Career Award for contributions to team training research from the American Psychological Association. So I'm going to spend a couple minutes telling you what this webinar is about. First of all, assessment, measurement of teams, interprofessional education is the #1 request of the National Center and always has been. So in 2013, we realized very quickly that this was what people were coming to the National Center for. We brought up the Resource Center that many of you participate in. And so there's a community-generated open source exchange. So anyone can contribute tools and measurement instruments in that center. In that year, in 2013, we had a parallel project that went on where we identified and looked at measurement instruments for teams and interprofessional education. And we identified at that time 26 tools, which are in a curated collection. So 2 evaluators evaluated them, and we came out with that collection. What our hopes were for that was that people in the community would comment, they would share ideas about the tools. So we as a National Center did not want to put our judgment upon those tools, whether one tool was better than the other, but then so that the community would generate their support or their recommendations for the tools. But we learned through the last couple of years that there were problems with this approach. So with your invitation for this webinar, we set out a paper that describes why in 2017 we're moving to a different model. We're building community capacity in a different way. So some of the things we've learned is that there is a high consumer demand. You are demanding of us. And often it's tell us what to do, make it easy to help us to help you select the right tool. We've learned that just because a tool is popular, it doesn't mean that it's a good tool. And an example is the ripples. And we have an editorial that Connie and I have written about that in our experience at the University of Minnesota. We also have noted that there's gaps in the measurement collection. So many of the tools are about attitudes and perceptions rather than behaviors and practice or performance on the Kirkpatrick model. What happened over time is that the collection became messy. So as our community was putting new tools in, there was an option to code the tool. And so that did not make a consistency for what a tool was, recommendations for the tool and the like. And then finally, assessment is more than a tool. There's all sorts of issues about the context of how it's going to be used, the how, the why, the when, how do you debrief the use of a tool. So we in the National Center noted that there were problems in the collection and that we needed to change. So this is the model that we've moved to, and in building capacity in foundational areas, and that'll be the rest of the webinar. And again, it's measurement, assessment, and evaluation. So there is still the Resource Center. It is open source. It's community exchange. Many qualitative tools will continue to be put into the Resource Center, and we advocate for that. And so mostly typically is an emerging area. It's to build theory. We're very supportive of local teaching and curriculum and programming. How do you share tools to be used in more than one location? But what is new is we've moved to an assessment and evaluation homepage. So what we will be talking about is that the measurement collection that Connie and Eduardo will be sharing with you is selected tools that Connie and a group called HUMRO, Human Resources Research Organization, that has many years history in performance evaluation and organizational development, and with an advisory board, has gone through and identified tools to vet and to evaluate. These are quantitative tools to measure interprofessional education and collaborative practice, processes, and impact on the Institute for Healthcare Improvement's triple aim. So it's referring to the simultaneous pursuit of improving the patient experience of care, improving the health of populations, and reducing the per capita cost of healthcare, so the triple aim. That's very important with what we have focused on in the measurement collection. And then finally, these tools will support, with the intent to support, generalizable evaluation and research. Then the next part of the home page is support resources. So we have the measurement primer that Connie and her colleague Michael Cullen wrote a couple of years ago, because as we learned, people needed support and help in selecting tools, understanding the context of how they would be used. We have the editorial that we wrote about the Ripples instrument, which admittedly is a very popular instrument. And what is new, another feature which is now new, is a consumer report-like tool on team assessment tools. So it is a resource that Eduardo and his students have prepared for the National Center. And then finally, we have our practical guides on assessment and evaluation, which we are launching today. And there is a fee to use the latter, the practical guides, which the funding will be invested in continuing to support this particular resource for the National Center. So with that, let me share with you today's agenda. So I'm going to be turning it over to Connie, and she will be showing and explaining the measurement collection, what's there and why, demonstrating how to search for and review tools, and then we have an area on frequently asked questions. Next, we will be turning it over to Eduardo, who will discuss an overview of support resources, the practical guides on assessment and evaluation, and the consumer report-like summary on team assessment tools. We will end this webinar with about 15 minutes of questions and answers, so that you can start teeing up what you would like to know from us relative to this collection. So with that, I'm going to turn the microphone over to Connie. Thank you.
Thank you, Barbara, and welcome everyone. I'm pleased to be able to speak with you today and to start off by giving you a short overview of what is in our collection. Currently, we have 47 tools, about a third of which are new to the center, which we found through literature review and networking. The rest were pulled over from our resource center or the pre-existing curated collection. About half the tools focus on groups or teams as a whole. The rest focus on individuals or loose networks of people, groups, or organizations. 3/4 of the tools are self-report. The rest are observational scales or tools, or recording systems, or like audits. About 40% of the tools address learner or trainee or practitioner skills and behaviors. The rest focus on values, attitudes, beliefs, perceptions of working relationships among colleagues, perceptions of other professionals, perceptions of working environments or teamwork. That also includes a few tools which measure organizational processes and outcomes of care. About a quarter of the tools might be potentially relevant for measuring the triple aims, and they're listed there. And 2/3 of the tools are open access and can be downloaded directly from our website. Well, what went into our thinking as we shaped the collection? The characteristics that we were looking for, the watchwords were quality, relevance, and usability. We wanted tools that clearly focused on interprofessional practice or education. Therefore, we eliminated some tools that looked at teamwork within a single profession, for example. We also avoided tools that measured important concepts or constructs like patient or family-centered care, unless they were clearly involving an interprofessional model. We wanted to find tools that had a good publication track record in peer-reviewed journals and reported more than user feedback and content validity. We wanted tools that are broadly applicable to the profession, so some tools that were too specific to a particular care population or setting or disease, and the items couldn't be readily adapted to a broader set of professions were eliminated. We selected tools that met general standards of quality of construction, specifically in the way the items or the scoring was formatted, and also we avoided instruments that we thought showed evidence of bias. We're still working to fill important gaps in the collection. As Barbara mentioned, we're trying to move towards finding more tools that measure the upper levels of the Kirkpatrick model. And we also are focusing primarily on tools that are in the public domain. Sorry. We know the collection is a living thing. We don't mean to put this out there to the world as a final product. We know it's imperfect, it has gaps, and it will need updating and monitoring. That's why we formed an advisory committee, and they're going to help us do things like identify additional tools from new literature reviews. We are welcoming recommendations from you all in the community for tools to add to the collection. We want to be able to respond to authors' updates as they add more research on their tools. And we suspect that over time we'll want to revise some of our policies. And we need to figure out how to sustain this. What we can't do is serve as the 1-800 number for individual requests. I am serving as interim editor for this year. There's only one of me. And even a small group of people, it's difficult to really understand your context and your situation, which is why we generally don't want to prescribe tools. Well, let's go view the site with the help of my colleague, Kurt Turner. He's going to show us how to get from the Nexus homepage to the Assessment and Evaluation homepage. And we're going to look at the search function of the tools, talk a little bit about the filters and the standardized profiles, and look at one of the answers to a frequently asked question. So with that, I'm going to turn this over to Kurt.
All right, thanks, Connie. All right, let me pull up our browser here and we'll start to go through the site. All right, hopefully in just a second you'll be able to see my web browser on your screen. All right, so a couple very quick ways to get to the site. We have the site marked under the Advancing menu item. It'll always be here under Assessment and Evaluation. That'll be a direct link. We're also going to be featuring the site on our homepage as well. We have it right here as another addition. So a couple different ways that you can access the site. So if we go there, Connie, would you like to begin kind of navigating and getting people oriented?
You see 4 pictures of the main resources that we're offering. Starting on the left, you see a picture that says, what should I consider when selecting a measurement tool? And this is the measurement primer that Barbara referred to earlier. And if you click on that, it will take you to a one-page overview of what the primer contains. So if you like what you read, then you can download this directly from the website. And I think Kurt will show you how to do that. It's also available for free on the University of Minnesota bookstore, and we'll be showing you that in a too. So that's what the primer looks like. Moving on to the next resource, this is the link to our practical guide series. And when you click on this, it will again show you an overview of the 3 guides that are available for sale now. And you can read what each volume covers. And then if you're interested in downloading the full versions, you click on that. Yes, and that takes you to the University of Minnesota bookstore. And these books are sold individually for $15 a piece, or all 3 for $35. And if you back out of this to the assessment and evaluation homepage, the next picture icon you see, to ripples or not to ripples, that is only part of the question. That is the editorial that Barbara and I wrote. It was published in the Journal of Interprofessional Care, January of last year. And it talks about the issues of validity with this tool and other tools that are like it. So we think it's a helpful component to understanding some measurement challenges. And then if you back out of this and move to the right, you see a consumer report-like paper on teamwork assessment tools. And this is the work mentioned by Barbara, by Eduardo Salas and his students. And he'll be talking more about that in a minute. So how do you get into the collection? Well, there are 2 ways. There's a search box, which I'm sure many of you are familiar with. You can enter in a title, author name, or any kind of keyword, like, for example, nursing. And if you do that, it says there are 22 results, and it shows you on the right a list of all the tools. And we have 10 tools per page. But we're actually going to back out of this for a minute and go to the other way to find tools, which is you click on Browse All Tools. And what I like to do is you can sort the list by a number of dimensions. I like to sort by title just because I like to see an alphabetical list of tools. So what we have on the left are a series of filters. And the filters are things like who is being assessed or evaluating, what kind of instrument type is there, what's the instrument content. And within each of these filters, we have a number of categories to which the instruments were coded. And if you go back up to instrument content and click on show more, you see we have quite a few content categories. And although we don't have tools in every content, we wanted to build the structure for this. Again, we're trying to find tools that will collect data that will help establish linkages between education, practice, and outcomes. This is also a good way to see where the collection needs some improvement. So let's put some of the filters into action. Say we want to look at all of the tools that measure behaviors and skills under instrument content. So we go to click behaviors and skills, and we want to see the tools that are readily accessible on our website. So we go down to the filter access and click on open access. And what we find is we have 14 tools that fit those 2 criteria. And again, this page shows you the first 10. Now I'd like to go into one of the tools, actually the first one listed there, the Individual Teamwork Observation and Feedback Tool, or ITOF. And I'd like to show you what a tool's profile looks like. This is a standardized format. We rewrote all of the descriptions, all of the tools, regardless of whether they came from the Resource Center, from the previous curated collection, or from a new literature review. So we begin by listing the authors. We write a short overview that talks about what kind of tool it is, who is it used for, what its purpose is. And then we have linked to resources. And this is where we have links to the journal articles or other websites where research can be found. Below that is the attachment field. Since this is open access, we attach the tool directly right there, and it's a PDF. If it's not an open access tool, that will be blank. Then we have descriptive elements, and we go through basically all of the filters. We list who is being assessed or evaluated, what kind of instrument it is, the source of data. Sometimes we add notes for data sources. Similarly, if you look down for instrument content, sometimes we write notes about the content of the tool. This is very helpful, particularly when it's not an open source instrument. You can't see it directly. Then we go through instrument length, item format, administration, scoring, language, norms, and access. Then our last section covers the psychometric elements, the evidence of validity. And here we summarize the research that we found in the article in the 5 sources of validity: of content, response process, internal structure, relation to other variables, and consequential validity. So that's what a profile looks like. And if we back out now, just to reiterate, Barbara had said earlier, we sent out a background document. If you have questions about really how these profiles were developed, or whether why we did the whole assessment and evaluation homepage, there is a place that you can find this background document. Why did we redesign the previous measurement instrument collection and website? You just click on that background document. Last but not least, we've developed a short FAQ section based on questions we've received in the last several months about the collection. You just click on those that apply to you. We talk about use of tools, what's fair game. And then one thing I wanted to bring to your attention is, if you have an instrument that you would like to see added to the measurement collection, how do you submit it? Well, first of all, we'd like you to review the criteria that form the basis of our review, and we list those below. And then we've created a form, the recommendation for the measurement instrument collection form. And we'd like you to, this is just a simple Word document. You can download it, you can type directly on it and expand the categories as you want. But basically, we want you to summarize some of these attributes of tools and then attach the actual tool and any articles that you feel have supportive research for it. And then if you save that and send it back to us at Nexus IPE, that would be great. And our advisory committee will be reviewing the recommended additions to the collection probably every 3 or 4 months. So with that, I think I am done. And Kurt, you can turn this over to Eduardo. Thank you.
Thank you, Connie. Thank you, Kurt. So what I'm going to do briefly is talk about 2 items, the practical guides, the three that are available right now. I'll give you some background and what's in each one of them. And then I'll talk briefly about the consumer report-like summary that you saw earlier. Oops. So first, the design and development of the practical guides were informed by 3 things. We started with the literature. So once you get copies of this nice guides, you'll see that there's a lot of citations. We based a lot of information that's placed on the guides, on the literature. Second, we conducted a survey of IPCP professionals. 19 of them were responded, and they were able to provide us with the critical attributes or the critical competencies that are needed for IPCP, and they rated this. So we use that information for the design of a couple of the guides. And finally, once we drafted the practical guides, these were vetted by a number of multidisciplinary experts. You see the list below. We did a trial at the summit meeting last year, and we got feedback from the participants in the workshop. And then we also sent the guides out to a number of other individuals who expressed an interest in providing feedback to us. So there are 3 volumes available right now. The first one is on what is teamwork in interprofessional collaborative practice. Essentially, this guy explains what teamwork is, again, based on the vast literature on teams across many disciplines, including, of course, healthcare and social care. So we borrow from aviation, from the military, from the corporate world, and we provided concepts that had some link to IPCP. The first guide, which is on teamwork, like I said, is really organized around the ABCs of teamwork. So as some of you know, teams do think and feel, and if they do, they have to have skills or behaviors. If they think, they have to have knowledge, which we call cognitions, and if they feel, there's attitudes. So we describe this framework a little bit, and then we use some of the top critical competencies that were identified by the subject matter experts. We use those as the main competencies that are described, and you can see at the bottom at least 6 of the 11 competencies that we described. Now, this booklet is also organized around 4 sections. So it talks about each of the competencies, and there are 11. We define the competencies. We provide behavioral markers for each of the associated behaviors. And we provide some guidance about actionable interventions of available tools and techniques that you can use to improve those competencies. The second guide is about measurement. It's about metrics. How do you design, how do you develop measurement approaches for IPCP teamwork? And this guide is divided into essentially 5 sections. The first one is why you should care about measurement, and we have some discussions about why you need it to assess team performance, of course, to identify gaps in skill levels, for developmental purposes, feedback, and to evaluate the developmental interventions like training. The second section really talks about the purpose. As you know, the purpose of measurement drives the kind of data that you need to have and the kind of instrument or tool that you need to have, and we provide some examples of that as you see there. The third section is how should I measure performance, and really walk you through the kind of things that you need to think about as you are either developing one or adapting one for your use. The last 2 sections refer to the types of measurement methods. So some are observational tools, protocols, some are survey-based, some are interviews, and some are archival data. So it describes each of these and what are the advantages and disadvantages of each one. And one of the concepts that's very important for measurement is the type of validity. So we describe the different validity concerns that you must we worry about, as well as some of the psychometrics. So this section talks about the content, the internal structure, relationship to external variables, and that kind of thing. So the third practical guide, which is available now, is essentially a step-by-step procedure or process for developing an assessment plan. So it kind of brings the first two guides into practice here. So it gives you, walks you through what things you need to think about and what things you need to be doing in order to have a robust assessment plan. Guide 4 will be available in the spring, and it's about a set of stories or case studies in assessing IPCP teamwork in academia and in academic practice setting. And the last one, now, maybe some more later on, the fifth one will be in the fall, and this is essentially a guidance for evaluating programs designed to improve teamwork capacity. And the last thing I'll briefly talk about is this consumer report-like summary that Connie showed you earlier. And what we did here is we wanted to, to reach to the literature and basically grade each of those tools that may be relevant to IPC evaluations and assessments. And so what you'll see in that report is 40+ tools that are relevant to IPCP, and we grade them according to their validity, their reliability, strength. Is it theory-based? How many times have been used? We essentially taxonomize each of the tools in the form that you can compare each one of them. It's, I think, a very useful way for you to see what might be appropriate for you, for your needs, what things you need to adapt or develop further. So I think that's all I have to say, and I'm going to turn now, pass the baton to Barbara.
So thank you, Connie, Eduardo, and Kurt for going through the content of the website, understanding what the practical guides are, and the consumer report-like tool that's on our website. So we're going to open it up. We actually are doing quite well on the time. We're about 7 minutes ahead of what we had scheduled. So this is your opportunity to ask us questions about the resources that you just saw. And I strongly encourage you to type in your questions, and Stephanie, I'm going to let you explain that, to us, and we will answer anything that you have questions for us today. So this is your opportunity. We receive questions every day on this, on measurement. So we have plenty of time for us to answer any questions that you might have, to take questions today. So I want to share with how you do that.
Yes, so if you direct yourself to the bottom right-hand corner of the WebEx screen, you'll see that the last comment says participants chat Q&A. Please type the question into the Q&A box in the bottom right corner, and you can type it in and hit send, and then we'll receive it in the queue. So our first question we have.
So the question that we have received is the Interprofessional Attitude Scale, NORA's 2015, included in the collection? So Connie, you're our expert on the 47.
Well, let's go to the website and find out. Kurt, can you get us back to the website?
Sure thing.
And whoever asked the question, I don't know if you have a second computer on hand. Again, we can show you how to find a particular tool.
So there are two questions while Kurt's pulling up the website about whether these PowerPoints will be available. And yes, they will be. So this webinar, it will be archived, as well as the PowerPoint slides. So those of you who are on the webinar can, access this webinar that you've participated with, or you can tell your colleagues that yes, they can join the archived resource.
Sure. So I don't know if you were able to tell there during the during our discussion, but I was able to search very quickly under Norris, and we were able to quickly bring up that tool here in our site. So I think, Kimberly, that was an answer to your question.
So, so the question is, does an individual interested in searching the tools need to sign up and have an account with the National Center?
No, that's not necessary right now. Although, you know, we absolutely encourage you to create an account because there are a lot of other resources outside of the tools here on this site that are available, and there's a lot of opportunities to connect with others in the field about some of the instruments.
So again, anyone can access these tools. You do not need an account, but obviously we encourage you to participate and upload information. So the next question is, many interprofessional education efforts are aimed at undergraduates. Do you distinguish what tools have been validated in postgraduate trainees in the workplace? So Connie, this is probably one, you're the one that reviewed each of these tools. Is there distinctions between undergraduates, pre-professional, pre-licensure, postgraduate trainees, and how they've been reviewed?
Great question. We haven't divided up quite as finely as our participant asked, but again, let's go to Browse All Tools. Kurt, you wouldn't mind doing that?
Sure.
And then you look at the filters, and then if you scroll down to the very bottom where it says Source of Data, you'll see healthcare providers and staff. We have 35 tools. We have, I think that's 16 tools that are focusing on healthcare trainees. Some tools will address multiple levels. Some tools, like the University of England's ELIQ, has several versions of that. So they measured students at the very beginning of their pre-licensure training, and then in the middle of their training, and then in their first couple months, I think, of their practitioner job. So yes, I think it's the University of there it is, West England entry level. That's the one that comes to my mind that gets it a little bit more fine-grained than our filters did. So I hope that's helpful.
And for that question, you're absolutely right, is that we're now starting to see a full spread of work in interprofessional education, starting with undergraduates up through postgraduate education. The next two comments are actually people telling us and your friends that this was a helpful presentation, so I'm very happy and thank you. A next question is, will there be any effort to pool data at the National Center for Research across multiple sites? Many of you know that we do have a network that has been working with us. It's now working in 83 sites. And frankly, we will be publishing an editorial in the Journal of Interprofessional Care. And we talk about how challenging it's been even in our research network with helping people select tools. So that's something we can have the conversation about. And, you know, obviously there's resource issues, but this is how we're really going to advance the field, by working together and collaborating. So it says, the next question is, early in the presentation, you mentioned a complementary site of evaluation tools for IPE called Humbro. My sound system was problematic. So Jessica, the issue there is, this is the 47 tools that have been reviewed. We worked with a company called Human Resources Research Organization, and what Connie described is the review. So that is the complementary site of evaluating those 47 tools.
May I jump in, Barbara?
Absolutely.
I'd like to make a call or shout out to Justin Pearl from Humro. Justin is a junior staff scientist with Humro, and he and I wrote all of the profiles together. And by working together and with others, we refined the criteria for what tools would be placed in the collection or not.
So the next question is, can any of the concepts and tools be used in the Team Steps initiatives? And actually, Eduardo was very instrumental in Team Steps. Would you like to take that one, Eduardo?
Sure. Yes. Actually, a lot of the competencies that we identify with collaboration from the subject matter experts, you can map all of them into the Team Steps teamwork concept. So, yeah, and some of the tools, you know, no tool is perfect, but some of the tools can be used to supplement some of the ones that the Team Steps program have. But yes, they can be used.
So one of the things I would add, because we were with a health system last week, and these tools aren't just for measurement's sake. And it is, so we observed a group that were telling us that they had actually used measurement instruments. The issue is how you use them, how you debrief them, and I love the term initiatives in this question, is that this is a comprehensive approach to using measurement, and some of it might be for research and evaluation, but it also can be how do you use it in practice to improve practice. The next question is, and I would say these two are similar, the next two questions. First one is, what percentage of the collection measures impact on patient outcomes? Next one would be related, but not at the patient outcome, is, do you have measurement tools on transforming care at the bedside? And I think I'm going to tee this up, but Connie, you can also, you know, you certainly are the expert in this area, but as Connie mentioned, and I probably didn't make it as clear as I could, the Kirkpatrick model looks at attitudes, perceptions, to behaviors, to performance and practice. And what we have found, and I think would mirror the field, is that very few instruments focus on that higher level of outcomes, of patient outcomes, or even performance in practice. So Connie, you might continue commenting on that.
Sure, and again, if I can have Kurt's help, if we go to Browse All Tools and look at the filter for instrument content and expand the instrument content to show more. If you can read this on your screen, you can see we only have 2 instruments that address patient-client satisfaction or experience of care. I'm not really familiar with transforming care at bedside. That term is new to me, so I'm sorry. I don't know that I have any other comments about that.
Right. Someone is asking a question about pricing of the practical guides and restriction about copyright. That's all explained in the practical guide. We have offered all of them for $35, and I think you said $15 for each individual. And again, we will be using this to continue to support this particular function on the National Center. We have another question, which is great, is called the UK. Health and social, our landscape has moved on considerably in the last few years, and there is an increasing emphasis on interagency collaboration rather than only interprofessional. Are there any relevant instruments in this collection? My suspicions are no, but I would say in the United States we are doing the same. And so an example, so we in the United States are moving to integrated health systems, so acute care to transitional care and the like, as well as collaboration with community agencies, social service agencies. And in the Institute of Medicine report that I served on that committee on measuring the impact on patient collaboration and health outcomes, there is a model in there that addresses this issue about really needing to have a focus on organizations as well as on the individual patient and the like. So I would say that this is an area that's growing, a need that will be growing. But I would that truly wasn't the focus on this particular first pass with the measurement instruments. Connie, you may have other comments on this.
No, I think that's a great question, great insight. I don't think we really have anything in the collection currently that would address that need. We have a few tools that look at organizations, but it's mostly things like determining whether a particular care site is appropriate for interprofessional education, or individuals who work within an organization, their perceptions or experiences with care processes, or kind of the cultural environment for interprofessional care. So that doesn't really get at agency-to-agency collaboration.
Right. The next question is, what are the exact fees for certain tools as examples? So and Connie, you can step in and correct me, but we selected tools that are freely available and not ones that there are fees for. I think that's where we landed on this.
Yes, hi, Barbara. Yeah, we have one tool, the Relation Coordination Scale, that is the licensed instrument. I actually do not know the fees. You would have to go to the website, which is listed under that tool, and speak with a representative there. The fees are based on usage. That means the number of respondents that are using the scale. And it's has other services. The organization that manages that particular tool also will help you collect the data, will help analyze the data, and generate reports for you. And those are all fee for service as well. So you would have to go to that particular site to learn more.
Okay. We have two similar, I would say, related questions. One is, how will, I guess, what we're developing address the need to document achievement of IPEC competencies to meet accreditation standards? In other words, will one have to use a number of tools in order to assess attitudes, behaviors, and cognition? And then a similar or related question is, have measures been developed that track similar dimensions of IPECP attitudes and skills from didactic curriculum into clinical settings? So I would say we are seeing several tools now that are very focused on IPE, the IPEC competencies. Several of them are on the resource center side of the website. And Connie, I'm not sure yet if any of them, to the point that they're in the 47. And then the other concept is tracking attitudes and skills from didactic into clinical settings. And that is literally taking a look at the continuum of learning. And this would, in my opinion, speak to, right now it's context specific. So, people are going to have to look at your own curriculum and how you would assess it over time. And I think you heard Eduardo, or it might have been Connie, say that there's no one perfect tool. So really understanding that big picture, how are you going to use it, under what circumstances, really is what your groups are going to have to come together and decide.
And Barbara, I couldn't agree with you more that the context and the way you use tools that measure very similar things to the IPEC core competencies can be used, longitudinally across time periods. But Kurt, if I may ask you again to go to Browse All Tools and type in IPEC, IPEC. We see there are at least two tools, the first one in particular, that are going to be almost word for word, if they aren't word for word, the IPEC core competencies. I hope that helps.
Yeah, and I know of at least two other tools that are on the Resource Center side on IPEC competencies. So these, the IPEC competency, there's no question are on everyone's mind. You know, that particular group is now up to 14 organizations, and their accreditors are very definitely coming together. So I think we're early in the work, and you're going to only be seeing more and more work in this area. Stefanos, we have a South African with us. Are the tools derived, divided up according to competency domains? And I would say no, not at this point in time. And Connie, I'll have you answer too, but he has also asked a question is, what are the biggest gaps in available tools? Are people working on it? How can one join in, even if you're not from the USA? Yes, and thank you, I know you're not a refugee. So anyway, I think I want to reiterate that most of the tools today are at the perception and attitudinal focus of measurement, that there is really not, there's a dearth of tools, at least in this space, relative to collaborative behaviors and performance, but there is some excellent work going on. We see it every day. As a matter of fact, I had a wonderful call at 11 o'clock from a group that's doing good work in this area. So we're fairly early in it, and I think we're definitely going to see more and more work in this space. We have our profiles on our website. We have opportunities for you to do private groups to have the discussion. We hope that this webinar and launching and relaunching the site will help with that collaboration. So we have another question about, is it possible to support whether the studies are cross-sectional or longitudinal? Connie, I'll let you take that one.
I'm sorry, can you repeat the question? I'm not sure I understood it.
So the question is it possible to sort the studies, so of which the literature behind these tools were cross-sectional and or longitudinal?
No, the answer is no. We didn't use that as a filter.
Okay. Another good question is, how many of these tools are validated for developing non-Western countries or cultures?
This is Connie. It would be hard for me to answer that. You'd have to go in and see, first of all, with each tool, whether it's been translated into other languages. And I think you'd have to approach that on a tool-by-tool basis to see. In general, we wrote the profiles based on the original author's original study. If that original author did additional studies revising the tool, we would often build that into our profile's description, or at least link it, the new citation. We could not do a comprehensive review of every tool to see whether other people had adopted it, used it in other places. So unless the authors contact us and tell us that the tool has been used in various countries or in various different settings, we don't really have the capacity to find that out.
But this would be a great, like a private group or really a discussion to help us take it to the next level, for sure. Mm-hmm. We have another question, which is measuring the impact of IPCP on the triple aim is harder to do. Are there any new studies or manuscripts that are in process that may help evaluators and researchers as they are just beginning to look at the impact of interprofessional collaborative practice? And what I would say is this is an area that people very much are working in, including education. But with the, in the United States, we're moving to value-based care, payments for care, and there is no question that interprofessional team-based care is very, very important. And it is, people are looking at what is the impact of teams on outcomes, because in the United States, 50% of payments quite soon is going to be based on value-based payments. So I have a blog that's coming out, if it didn't come out already today, about this very topic, and as the editorial inject. So for those of my colleagues outside the U.S., this is a growing area of how do we link quality of care with outcomes, and that's how we're going to be paid in the United States. And given the change in administration, the interesting thing is this is an area that everyone is very, very interested in. And we are designing our summit in August on today, and that will be a big focus of our work in the summit. So we have, thankfully, TCAD was developed by the Robert Wood Johnson Foundation and the Institute for Healthcare Improvement, specifically for hospitals, and information can be found on the IHI.org website.
Barbara, if I may jump in, back to that listener's question on program evaluation and evaluation research. I love the question. I've been a program evaluator for 30 plus years. I've worked in many different kinds of settings, and I'm really pleased to be one of the main authors on the 5th practical guide that's coming up on how do we evaluate the efficacy of training programs and collaborative practice on outcomes. I think it's a really challenging area. So I look forward to doing this work, and hopefully I'll come across some studies, and if I do and you write me, I will send you whatever I find.
So there's another question specifically about the consumer report-like resource, and that is totally free on the website, so that there is not a fee affiliated with that. The practical guides is a one-time purchase fee. It's just like a book that's available. Another question is, will there be a way to tell others that you are using a particular tool so that we can share best practices? Actually, there's several related questions. And again, this is an example of, we do have private groups that are affiliated with our resource center, and frankly, put this on your evaluation. And so, again, there's enough questions here that we need to get feedback on this these types of questions, how to partner, so that we can understand it and help support this. The direct link to the bookstore actually will be embedded in the slides when you get it. We'll be sending that out to you, how you access the archives and the tools and things. There is a question about are tools available to identify stages of IPE readiness for sites, an emerging site versus one that is deemed suitable for IPE. I would say, just as you know, we've actually been working on that ourselves in the National Center called Insight. We just had the tool validated. And it's based upon Brian Sick here in the National Center at the university. This is has been a real area of interest for him because, as you know, we can do all the work in the classroom, but if we send students out into practice, into sites that are not modeling teamwork and collaborative behavior, that's a problem. So there is lots of development on this. But I would say that it isn't ripe yet. And I'd say one of the tools on the website is the ACE-15, and that is more about teams and practice, but it very definitely could be used if you were developing rotation sites. Another question or comment is, I'm aware that UC Davis is doing a systematic review of IPE tools. Are you aware of other such efforts? And I would say yes. I would say University of Southern California, I think, did one. There's been a lot of systematic reviews of the tools, and we actually recognize that in the paper that we sent out in the editorial. And so one of the issues, this is an issue of a lot of us are replicating work, and how do we help each other advance the work? So that, again, we would love to have that conversation with those of you that have obviously high interest in this area. Someone wants to know, what is the IOM report reference? This is the measuring the impact of interprofessional education on patient collaboration and on collaboration and patient outcomes, I think it was called, and it is was released in April 2015. And we did a systematic review of the literature at the time. Scott Reeves and Brenda Zerler and Malcolm Cox and others were on that committee. So it is a pretty thorough, systematic review of the state of the art of measurement at the time. Question about, do you have any resources or literature on the quadruple aim yet? That is in the literature and not yet in this particular measurement. And then the last question that we will take, I guess we're running over, is about the blog that we sent out. If you were on our list, you would have received it. If not, it'll be on the nexusipe.org site. So I'm getting the high sign, and I am thrilled at the engagement on this webinar. This will be archived. You will be receiving an evaluation form to provide us with feedback. Lots of great questions, particularly around engagement. And somebody said, great question and answer webinar, and I love our questions and answer session. And I couldn't agree more. I love to have this kind of interaction. Thank you very much.